Good afternoon and welcome to our 23rd weekly virtual webinar. Today is Thursday, August 13th, and we are so glad that you joined us. I am joined today by Gary Herbst, our hospital CEO, and we are not only going to answer questions that were pre-submitted, but we are going to have our chat lines open. You can also raise your hand during this meeting and we will make sure to call on you. But Gary, welcome back. Last week we had Carrie and John, and It was a very lively meeting, and I had a couple of you respond on how what a great job they did. So rest assured that when you are gone, you are well represented.
I just feel grateful being invited back. That I after 20-something weeks, I wasn't so easily replaced. So thanks for having me back.
Well, and I understand that you're not going to be available for one of our meetings in a couple of weeks.
Yeah, so actually next Thursday, my family and I are finally going to go celebrate my 60th birthday that actually happened back in April. But that's when we were sheltering at home and had to cancel everything. So
are you doing something fun?
Yeah, we're gonna. We've rented an Airbnb in Summerlin, which is between Santa Barbara and Carpinteria. So kind of getting out of here a little bit.
Yeah,
so,
that's nice. Well, happy birthday in April.
Yeah, thank you.
Now that you're almost 61.
Ooh,
I know.
don't push it.
Well, so let's go ahead. Just before we get started, though, just to remind you that this meeting will be put on our COVID page on the Quia Delta website. We also have the questions and answers written out, so it makes it easy for you to go back and review anything that Gary has said. All right, so are you ready to start?
I am.
Okay, we're going to start with the numbers.
Start with the numbers.
Let's start with the numbers.
Just got back into the saddle again, so yeah, fresh off the internet, the various websites I go to, plus a lot of internal information as well. I think many of you probably have read that the state recently announced that it had quite a bit of a glitch in its reporting system, the CalReady system, which is used statewide to capture all of the COVID information. And they'd had, I guess, a problem with their server that's now been rectified, and they've caught up. They processed about 300,000 reports over the last several days, capturing all the positives and negatives, but apparently they're now completely caught up, so I think I'm reporting on accurate information. So to date, the state has performed 9.3 million tests statewide since the pandemic first broke out. 586,000 of those cases were positive. And interestingly, and I think I've shared this over the last few weeks, is that 410,000 of those 586,000, or 70% of those people, are younger than 50 years old. So the vast majority of the people that have been testing since the beginning of the pandemic are relatively young people, younger than me. And sadly, we're now up to 10,648 deaths, which represents about 1.8% of all the folks that tested positive ended up passing away. That 1.8% death rate is identical to what we have been experiencing here in Tulare County. So pretty much mirroring the state. As of today, there are 5,442 COVID positive people that are hospitalized across the state. About 1,700, or right around a third of them, are in the ICU. And I'll give you a little bit more context there as I will move down through the county and then to Quia Delta specifically. There have been a little more than 27,000 healthcare workers that have contracted the virus, either in the work space or outside of it. And there have been 141 deaths among healthcare workers. That's about 0.5%, so significantly below the 1.8% that the state has experienced statewide. But healthcare workers tend to be in the younger age category, and the definitely the majority of the deaths across the state have been in the older population, generally those that are more than 65 years old, probably not in the workforce anymore. So to see a lower death rate among employed healthcare workers makes sense relative to the rest of the state. And then lastly, at the state level, disappointing to us that the San Joaquin Valley, the Central Valley, continues to be a hot spot. In fact, we've even recently made national news. We were named one of the top 10 hot spots in the nation. And folks that are doing interviews back in Washington, D.C. are referring to Tulare County and the Central Valley. So certainly not the notoriety that we would want on a national basis, but it is the reality. 58 counties make up the state of California, and right now 38 of them are on the state's watch list or monitoring list. And when you're on that monitoring list, it imposes tighter restrictions on your ability to, open parts of your society up, open up businesses. We had to shut down the Lifestyle Center. We had to shut down, in-house dining. Just read this morning that while elementary schools were allowed to apply for an exemption to the distance learning, even though all grades will initially start out with distance learning, the state has a provision that would allow counties to apply for an exemption for elementary school that they could return to physical learning in the classroom, but that exception process is not available to counties that are on the watch list. So Tulare County, for the time being, will not be permitted to file for that exemption. So pretty much, Fresno, Tulare, Kern, Kings, all part of that watch list. So moving down to the county level, so the states performed 9.3 million COVID tests. The county of Tulare, we've performed 90,000 tests countywide since inception. 11,643 of those tests were positive, which ranks Tulare County as the fourth highest among the 58 counties in terms of number of positive cases per population. We've had 205 deaths, which I mentioned earlier is exactly that same 1.8% of all cases that have tested positive. But that actually ranks us third of the 58 counties in terms of deaths per population. On the very positive side, almost 90% of the people that have tested positive for COVID have fully recovered. So 10,120 of the 11,643 fully recovered. There still are 321 people that are being quarantined right now, but we are seeing fewer and fewer that are in quarantine and more that are recovering. So that's very encouraging to see that. Right now we have 98 patients county-wide that are hospitalized. Again, that's pretty much just between Quia Delta and Sierra View Hospital. And I'll talk a little bit further about that in a moment. The 7-day rolling positivity rate, again, the percentage of people that are tested that test positive, we now, instead of reporting since inception, we're actually, because it's more important to know what's the current positivity rate, whether it's going up or down. And so both the county and Quia Delta are using kind of a rolling 7 days, a rolling 14 days. So the most currently published 7-day positivity rate for the county has us at 13.4%, which is more than twice what the statewide level is, certainly much higher than that 8% threshold that the state wants to see counties stay below before they're willing to allow them to open up. But that, on a positive note, that 13.4%, so that was as of August 1st. So that's the last reported figure. But just a week earlier than that, on July 27th, that positivity rate for the county was at 18.3%. So just in a week, we've fallen from 18.3 down to 13.4. The highest rate that the county had observed throughout the entire pandemic was way back on April 6th. And it probably was high because back then, for the most part, we were just testing symptomatic patients. There's more and more testing of asymptomatic patients that are occurring. But back on April 6th, the positivity rate was at 18.9%. So interesting that that was the high water mark, but we were so close to that just a few weeks ago on July 27th at 18.3, but now down to 13.4. So now moving down to Quia Delta, again, hot off the press at 6:30 this morning, which a daily email goes out. We only had 57 COVID positive patients in-house, and 57 is still a lot. Particularly when you think back in May and early June, you know, we had fallen down into the 20s, and but just a few weeks ago on a Saturday, we were at 91, and we were holding pretty steady at that high level. We did see it kind of drop down into the 80s and then the mid 70s, but literally 57 cases is the lowest number of cases that we've seen in probably a month. So I was really excited to see that this morning. 5 of them are in the ICU, 17 are in the intermediate critical care unit, and of all those 57 that are in-house, only 4 of them are on ventilators at this point in time. So we're seeing more and more patients that do come in with COVID, they're too sick to stay at home and recover there. They generally need some form of oxygen treatment, steroids, you know, they might have their underlying chronic conditions might be exacerbated because of the COVID. So better that they're definitely in the hospital, but not seeing as many that need that mechanical ventilation to help them breathe. Quia Delta's positivity rate, similar to the county. Just a few days ago, we were at 21%. And ours always runs higher because except for those elective surgeries where we are testing asymptomatic patients for COVID, other than them, we only test symptomatic patients. So they're much more likely to be positive because they're exhibiting symptoms. But so we were at 21%, but just as of just a couple days ago, we're down to 17%. So like the county, we're seeing some improvement there. And I'd really like to attribute that to our citizens, our residents. Hopefully they're listening carefully, they're following this information. The 4th of July holiday, is it's behind us now, and perhaps folks are out there exercising, all the things that we encourage them to do with the hand washing and the masking. And but we definitely were holding our breath a bit for the Labor Day holiday, which will be here in just a couple weeks, and then we'll see what happens after that. We'd love people to continue to exercise, good precautions and to do the right thing. Okay, so all right, where was I? Positivity rate. So right now we have 72 employees that are out on leave. That's also an improvement. Not too long ago we had over 100. I'm so glad to see that number coming down. We've had 231 of our employees that have recovered, and there are currently no hospital employees that are hospitalized right now that are in the hospital. So just a week or so ago, we had 5 of our employees that were hospitalized. They've all been successfully discharged and are recovering at home. I get often asked about ventilators. So I've mentioned that we own 96 ventilators, adult ventilators. There are currently 45 of them that are in use, only 4 of them for COVID patients, so the rest are non-COVID patients that need help breathing. But that allows us to have 51 adult ventilators that are available to us. So I think given what we've experienced throughout the pandemic and even what we saw during the resurgence, I think we're in really good shape in terms of having ventilators. One of the things I haven't reported on in the past, and as I'd mentioned a couple of weeks ago, we're a lot of us are working on completely overhauling our dashboard and the information that we're giving to people. People are asking us for different kinds of information, and so we want to be really responsive to that. So since inception of the pandemic, which really we saw our first case in March, so from the first part of March until today, we've had a total of 720 COVID positive patients that have been hospitalized during that entire pandemic. Of those 720 patients, 112 of them passed away. Of those 720 patients, only 55 were ever on ventilators that actually had to be intubated, and I was surprised by that it's I guess a relatively low number. But unfortunately, of those 55 that were on ventilators, 38 of them died. And so you do hear across the country, the last thing we want to do is to have to put a patient on a ventilator. They are acutely ill at that point. And unfortunately, a lot of the therapies like remdesivir and other, the antibody plasma, we're not seeing as much success in those patients that are on ventilators. So that's why we're learning more and more, and giving those therapeutic treatments maybe earlier in a patient's hospitalization might prove more successful than giving it to them at the latter stages. But a fairly low number of patients on ventilators, but unfortunately a very high mortality rate.
Right, right.
In terms of, and I don't know if you want me to talk about surge capacity now, or
Sure.
So again, every day is different. We wake up to new conditions every single day. Yesterday, I attended a meeting with the state, and the state and the county. The state's actually here over these last 2 days, all day yesterday and all day today. Donna Hefner, who's the CEO at Sierra View Hospital, she and I wouldn't say testified yesterday, but reported to the state, kind of our condition and our surge capacity, and talked a lot about, what are the biggest challenges around staffing and PPE and so forth. But yesterday I was reporting to the state that our overall occupancy in the Quia Delta Medical Center was at 91%, meaning that we're pretty full. This morning it's 82%. So we discharged a lot of patients yesterday, and so to be at 82% occupancy, again, another very positive sign, gives us a bit of breathing room. It also, in terms of just our surge capacity. So right now, in terms of critical care capacity. So we have 2 ICUs, a 21-bed medical ICU, a 20-bed cardiac ICU, and we have 2 intermediate critical care units, 3 West and 5 Tower in the Quia wing. Between the 2 of those units, I would say we would normally, right now in this COVID condition, we would have 10 available beds. But both on 3 West and the medical ICU, we traditionally double up some rooms. So 3 rooms on the ICU, we would typically, like in a severe flu season, we would have a double occupancy. And 11 of the rooms on 3 West, we would have a double occupancy. So right now in COVID, since many of our COVID patients are placed in those units, we're trying to use single occupancy only, so we can really isolate and not cross-contaminate patients. So staying single rooms, we would have 10 additional critical care beds available. But if we were to go to the normal doubling, that would add an additional 13 bed capacity, which we could do. So theoretically, we have 23 available critical care beds. We then, when we look at all other beds throughout again, this is just the acute medical center, there are an additional 50 beds that are empty. So between critical care and medical surgical, we actually have 73 physical beds that are available for occupancy in the acute medical center. If we go outside the medical center, which we would in the event of a major resurgence. We have beds at our Court Street facility. We have beds at our rehab hospital on the West Campus. Between the two facilities, there are 47 additional physical beds that are available. So between the medical center and our other facilities, we have a total of 120 empty beds right now. And we would always look internally first for surge capacity before we would consider an alternative care site like the Porterville Development Center, or the idea of opening up the convention center or COS. We would always look internally. So that represents a surge capacity of 35%. So we literally could expand beyond our current occupancy at all of our facilities an additional 35%, in theory, in terms of physical beds. The problem is we don't have the staffing. That's our biggest challenge right now. It's the biggest challenge of every hospital. It's the biggest challenge for Sierra View Hospital. In fact, Sierra View is probably feeling a more intense condition right now, not just COVID, but we actually took a few Sierra View patients last night. We transferred them from Sierra View. They were non-COVID patients, but we had some bed capacity where they didn't. So just working together to support one another. But staffing is the biggest challenge. We are still continuing to work with the military staff. They were supposed to end their tour of duty with us on August 7th, but they extended their stay for another 14 days, so we're very excited about that.
Okay, so let me ask the question, just
Okay.
so we can post it. So, Gary,
Yes.
is the military team staying longer to assist with staffing?
Yeah, sorry, I
needs?
got off script a little bit there, yeah. So the military,
Sorry,
mostly from Travis Air Force Base, sent 21 healthcare workers to us, physicians, nurses, respiratory therapists, and so they've been working with us side by side, taking care of our patients since July. They initially had a 30-day deployment, which ended on August 7th. We asked for them to stay another 30 days, but apparently, they're not just working with Quia Delta statewide. They're working with other hospitals, and they were only able to extend those tours of duty by another 14 days. So they just granted us. I think we just found out this week that we are approved for another 14 days. We hope we wouldn't need them past that the trends that we're kind of experiencing will continue. And hopefully, again, we don't get that Labor Day surge. But we've kind of been preliminarily told that this will be the last deployment, that they won't extend beyond this 14 days now. But perhaps that would change if we did see that resurgence in the latter part of September. So we're eternally grateful for the folks. They've been incredible. I think they've also had an amazing experience working with Quia Delta, but we're going to be sad to see them go, but again, just so grateful for their presence here.
Right. So let's go back to the surge plans that you were just talking about. So one of our community members heard that we now have a lot of pediatric COVID patients here at Kaweah Delta. Is this true?
No, we have had a few. We actually, our pediatric unit right now is closed. It's a 12-bed unit, and we purposely kept it closed to provide, an emergency surge unit if we need it. But we still are seeing children, pediatric patients that are non-COVID, and if we need to admit a pediatric patient, we're admitting them to our mother-baby unit, which is an adult unit, but it's perfect for having kids as well. But we have had, over the course of the pandemic, we've had several COVID-positive pediatric patients, but it's rare. We don't really have many. I think we might only have one that's in-house right now. But just a week or so ago, Valley Children's Hospital announced that they had 69 COVID-positive pediatric patients. So definitely kids are not immune from it. They are getting it. although the state just reported our very first pediatric death statewide just a few weeks ago. A 17-year-old individual passed away because of it. But it's been obviously extremely rare to see any pediatric deaths, but there are kids that are getting the virus, but they've been successfully able to overcome it.
Okay, thank you. We are still getting questioned about the way we are reporting our hospital capacity. So, you know, I don't know if people don't like the way we're reporting it. They think it's misleading.
Well, I kind of, I just walk through, you
Right.
know, again, it's a report I get every single day, unit by unit, the number of available beds, the number of beds that are occupied, the number of beds that are available for occupancy. You know, we've really, for the most part, just been reporting on the occupancy and the bed availability of the acute medical center, because that's essentially where we're taking care of positive COVID patients. COVID patients, as of yesterday, only represented 21% of our total patients. So still the vast majority of patients we're taking care of are non-COVID. They're just here for all the other reasons that patients need to be hospitalized. Yeah, I don't, you know, I don't know where that feeling might be coming from. Occupancy definitely changes every single day. We are constantly discharging patients. We discharge anywhere from 40 to 70 patients every single day, but then we're admitting more and more patients every day. Some of them COVID, some, you know, most of them not. So yeah, just to go from yesterday was 91% occupancy, and then today's 82%. Tomorrow it might be back up to 90% again. But it really, you know, patients stay 1 day, 30 days, and all along that spectrum. So if there is a way that folks would like us to report it in a different way or report additional information, I actually think the dashboard that we've been publishing on our website and on Facebook and so forth has not really included any bed occupancy information, but we are going to change that. That's one of the things that we're going to add to the dashboard so that folks get a sense of what kind of bed capacity do we have.
Right. Okay, thank you. So can you tell us the total deaths that were recorded last year at Kaweah Delta from April through August compared to the total deaths at Kaweah Delta this year from April to August?
Yes. I don't know if I can report that exact time frame. And I hope I brought that document with me. I probably didn't, so I'm going to have to try to remember it off the top of my head. So, Anu Banerjee, who is our Chief Quality Officer, one of our vice presidents, distributed an email to our executive team, I think it was yesterday, that showed the total number of deaths that occurred at Quia Delta for calendar year 17, 18, 19, and so far in 2020. Calendar year 17 had roughly 750 total deaths over the year. 18 and 19 fell down into the 600s. And if I recall, 17 might have been the severe flu season that we experienced. Really, it was a record year. It was one of the worst flu seasons in 10 years. A lot of hospitalizations and a lot of deaths attributable to it. But under 700 in each of 2018 and 2019. The total number of deaths, though, that we've experienced through, say, January to the end of July, we are on pace to see as many as 900 deaths. So a pretty significant increase from calendar year 18 and calendar year 19. Now, I haven't delved into it, to look at the nature of those deaths for those different time periods. As I mentioned earlier, we've had a total of 112 deaths at Quia Delta that are COVID related. So are those, unique deaths that those people would not have died? Now, remember, most all of them have underlying conditions: diabetes, congestive heart failure, COPD, chronic illnesses that do shorten life. They do lead to death. We have people that die of those diseases. But, would they have died this year if not for COVID? And we don't know that, because we also hear that COVID causes heart attacks, it causes strokes. Patients that died at home of a stroke or died at home of a heart attack, I don't think we test them to see if they also had COVID. So we definitely, are seeing a higher death rate over this last year. And maybe it's entirely attributable to COVID, no doubt about it, that's, I believe, added additional deaths that we would normally not have seen. But are we also seeing a rise in cardiovascular deaths or cancer deaths? Or that's something that we will look at. I know the questions come up also at the county level. We were asked that in the town hall meeting the other night, that at the county level, looking at all deaths, what have we seen over the years, and is 2020 significantly higher because of the presence of COVID?
Right. Okay, thank you. So can we please start publishing the two numbers on your graphic that are used to configure the positivity rate?
Yeah, so if you know math, sorry.
I don't know math.
Yes, I know. Sorry. No, I didn't mean that you don't know. Yeah. So we publish the positivity rate and the number of positive cases. So you can actually back in to determine then what are the number of tests that were done by using some division. But I know a lot of us are. I'm not going to get out of this one.
You're not going to get out of this one yet.
I guess the short answer is yes.
Okay.
Because I mean the information's there, and I believe that is our intention to put it back on the dashboard. People do want to see that. So the state, they report the number of tests and the number that are positive. So does the county. Quia Delta should do the same. So
okay.
Yeah.
Thank you.
Yeah.
So here is a question for you. Will COVID-19 end after the upcoming election?
Gosh, I sure hope so. Yeah, so it'll all end on November 4th. Is that the election? I think it's on November 3rd, and yeah, that would be wonderful. I highly doubt it, unless the vaccine is unlikely to be available generally at that point in time. Very positive things that we're seeing. Obviously, there are a number of the companies, a joint effort with the federal government. There's many vaccine projects that are being pursued right now. Moderna being one of them. AstraZeneca, I think, is another. Moderna is in its phase 3 of its testing. There is a fourth phase, the final phase, before it's deemed entirely safe and ready for mass production. The government is already kind of, and the CDC, deciding who would be the first segments of the population that would be vaccinated. Would it be?
Would you sign up for that to be the first?
Yeah, I've been asked that. Healthcare workers will definitely be at the the front of the line, because you'd want them to have the greatest protection so they can continue to take care of people. But then also, I think the vulnerable populations, those that have underlying health conditions, those are in nursing homes. I think I would be one of those that will take it. Although interesting, I think a recent poll showed about 50-50 maybe across the country in terms of those that would be willing to take it. I definitely think there was a higher percentage of those willing to take it than those not. And I tell you, I just admire and applaud those people. There are 30,000 people that for the Moderna vaccine test, the phase 3, that got vaccinated. 15,000 with a placebo,
Right.
15,000 with the actual virus. And to have 30,000 people sign up and say, yeah, you know, while it's still in the testing phase, and I mean, what a, you know,
But then
a
how
personal
would they
sacrifice.
know?
Well, they don't. So what they do is they follow those 30,000 people, and to see, you know, they follow them every day to see who contracts the virus, who develops symptoms. You don't know if you've been vaccinated with a placebo or
So
not.
do they stop wearing a mask and just go into stores?
I don't know that. I suspect not. I suspect not. But maybe there's some exposures that they artificially create to be able to test it. So, yeah.
And I just like to remind everybody that Quia Delta is not a political entity. And when people ask me questions like this, I always say, I watch our numbers.
Right.
That's what I watch. You know, you watch the news and, you know, you take that for what it is. But I watch Quia Delta's numbers because that is the indicator to me of how COVID is affecting us locally. And Quia Delta doesn't just admit patients for the fun of it or because it's politically or not politically correct.
Right.
We admit patients who need to be admitted.
Yeah,
So,
and I tell folks, you know, as a public hospital, you know, we are owned and governed by our community. Our governing board is elected by the people that live in our community. We answer to the community.
Right.
We are a completely apolitical organization. We take care of everybody, irrespective of your personal politics, you know, anything, rich, poor, ethnicity, sexual orientation. They're meaningless to us. I mean,
Yeah.
we respect all of those, and when we provide care, you know, we if you're a religious person, we want to honor your religion and you know, support you during your stay. If you have certain beliefs, we want to honor those beliefs. And I suppose if you were a Democrat or a Republican while I'm in the hospital, I want to get the Republican newspaper or the Democrat newspaper. We do our best to deliver it to you, but yeah,
Right.
and I know we all know there's incredible underlying politics
Right.
that are involved in
Right.
this pandemic, and it's sad, it's disappointing. I think it hinders our ability to work together. You know, the mantra right now is together we'll get through this. And Quia Delta, we embrace that. I mean, together, we as the Quia Delta family, we as a community, we working together, we will get through this. And
Right.
I wish our politicians
Right.
would as well.
And, you know, we do an employee huddle every Friday, something similar to this, but it's for our employees. And we have hundreds of employees that join us, and the politics wear on them because, you know, they're working hard, trying to save lives, and, you know, they're getting hit by the community, social media, just about politics.
Right.
And it's like, this is about healthcare. So I just wanted to throw that in there. Okay, so Noreen Kushner just sent me this email and she said, do you think it would be helpful to point out that upon acute recovery, patients can be transferred to rehab or skilled nursing for non-acute needs such as physical therapy? During last week's meeting, she thought it might have been misinterpreted that we needed to use beds for acute patients on the other campuses.
Yeah, yes and no. So absolutely, thank you, Noreen. Noreen was the director of skilled nursing
Yes,
services
yes.
at Quia Delta, so it's near and dear to her heart. Quia Delta has skilled nursing services at both our South Campus, which is over on Court Street, as well as on our West Campus. On the West Campus, we have a 61-bed rehabilitation facility. 45 of the beds are for acute rehab, patients that have suffered, you know, major catastrophic injuries, strokes, joint replacement, you know, that require an intense amount of physical therapy or occupational therapy, speech therapy. We also have a 16-bed, what we call short stay, skilled nursing, still rehabilitative in nature, but not as intense. But those services have continued to operate throughout this entire pandemic and continuing to provide that acute rehab and skilled nursing. So we do direct admits, so they don't have to necessarily be a patient of the acute care hospital before they would go there. But definitely, as Noreen points out, patients that came into the hospital non-COVID, had a hip fracture or suffered a stroke and need that continuing care, but not at the acute level, but rehab or skilled nursing. They absolutely are continuing to be transferred and receiving those therapeutic services. Now that said, for whatever reason, we have seen a lower census in the acute rehab hospital. Some of that is attributable to us having to scale back elective surgeries. So a lot of those elective surgeries have been orthopedic in nature, a joint replacement, something where that patient might benefit from acute rehab or skilled rehab, but those surgeries are being postponed. So that has caused the census at the rehab hospital to run on the lower end. In fact, in that 45-bed unit, we currently only have 10 patients that are in that hospital. So there are 35 beds that are open. And they have had a few COVID patients at that facility, both in the rehab and in the skilled. We are able to completely isolate them from other non-COVID patients, and our staff wear all the PPE. They're lockdown units, no visitors. We test employees, temperature and everything every time they come in and out. But we are now looking to do admissions from the medical center that aren't necessarily rehab patients. So we might, in fact, I think I understood yesterday from our command center meeting that 4 non-COVID patients that are currently in the acute medical center were being transferred over to the rehab hospital to make room in the medical center. So to Noreen's question, it's kind of both. We continue to take those patients, but we also, where we need to create some bed capacity in the medical center, we will start using them.
Okay. So we have a few questions coming at me from email and text, but I'm going to ask this one really quickly. So with all of the layoffs and cutbacks at Kaweah Delta, have our top administrators taken a pay cut?
Yeah, actually, I went to our executive team and to our board, I think it was back in April. We had really seen one of the worst financial months in our history. I think we lost almost $12 million in the month of April, largely from shutting down surgery. But I asked all of our vice presidents to take a 10% cut in pay for the months of May, June, and July. I took a 20% cut. Those funds were set aside to help fund the employee relief fund for employees that were suffering financial hardships from being furloughed or having their hours cut. The foundation had created this fund to help them. So those salary cuts that the executive team took were helping support that. And to the extent they were not needed for that, they went back into Quia Delta to help cover its losses. One of the things that obviously we've had a lot of discussion around the budget that we put together for the current year, where we budgeted literally to just break even, no profit at all, just a break even bottom line. And there were many things that we had on the table to be able to achieve that. Our primary objective was always to preserve jobs, to not have to lay off more people. And I think we've been able to successfully do that. We did have some layoffs during those very difficult months, and we have, where we haven't needed to hire among our executive ranks. Tom Rayner, our Chief Operating Officer, one of our senior vice presidents, retired in July, and I was recruiting to replace him, but I froze that. And I've asked our other vice presidents to take on all of Tom's responsibilities. And so we've reallocated those departments. We've always had a chief medical officer. When Ed Hirsch retired a couple years ago, the natural reaction would have been to replace them. But I kind of put that on hold, not because of COVID, but just the financial challenges that we were seeing, we were experiencing. So we did not replace that chief medical officer. So, again, to preserve jobs, where we can avoid having to immediately replace a position. We now, especially at the leadership level, at the director and executive team level, which tend to be your more highly compensated, positions. We, as an organization, philosophically, we set compensation for all leadership positions at the 50th percentile. So we need to be competitive. We want to attract the best and the brightest, those that are highly experienced and successful and can do a great job leading this organization. But at the same time, we're very mindful, that we're a public hospital and just the financial constraints that we're under. So we did look at a lot of different things. We did make a decision to freeze salaries, and that's across the board. So our vice presidents, all of our leaders, our staff, none of them are receiving a pay raise for the current fiscal year we're in. But we purposely did not cut anybody's compensation, and that would absolutely be, our desire that we don't have to do that. But if things get worse, we just saw July's financial results earlier this morning. They weren't great. We had a $2 million plus loss in the month of July, although we did have stimulus funds, about $3 million in stimulus funds that are pretty much going to break even and cover that. But the board, as I mentioned again a couple weeks ago, every single month the board wants to have a special meeting just to review the financials and talk about the budget and determine if we need to make any other budget cuts. So cutting wages, and I would first approach the leadership team. That's why they're leaders. They know that in difficult times, leaders have to step up and they have to lead. And so I would go to the executive team, I would go to our directors, and I would first ask them to take a pay cut. The last people I would go to are staff. Those that are on the front line, those that, our nurses, our EVS workers, I would do everything I could to not have to reduce their wages. But definitely, if the need should come, I'm prepared to go to our leaders and ask them to take a cut to support the organization.
Okay, thank you for that, Gary. So have we slowed down the rate of elective surgeries?
No, we talk about it every single day, every other day. Our command center meets at 11 o'clock every single Monday, Wednesday, Friday, and then at 2 o'clock this afternoon we have an entire meeting of our leadership team, Jag Bath and Ryan Gates, who are our demobilization co-section chiefs. We're evaluating it every single day. Right now, particularly on the inpatient side. So we are currently allowing 11 elective inpatients on Monday, 9 on Tuesday, 8 on Wednesday and Thursday, 10 on Friday. The difficulty we're having right now is the availability of COVID testing supplies. Unfortunately, the BD Max and the Abbott ID Now platforms, the platforms are great. The reagents, the kits that we use are now in scarce supply again. With the national resurgence, we're barely hovering above what we call our minimum par level. And we do a COVID test on every single elective surgery that we perform here. And so if testing supplies continues to decline, then we may have to further reduce elective inpatient surgery, because first and foremost, our testing has to be available for our inpatients. Patients that are going to be admitted, we need to know where we place them. We need to know if they're COVID positive or negative. And so if we get to the point that we don't have that testing supplies, then we may be forced to further reduce those inpatient surgeries, or if we see an enormous resurgence again. You know, if we find ourselves back at almost 100% occupancy, back to 91 COVID patients that we saw just a few weeks ago, then it becomes a bed availability issue, and you would reduce inpatient elective surgeries to create some bed capacity. So really those two events, the availability of COVID testing supplies, the availability of inpatient beds, that's what we're watching every day to determine if we need to, you know, change elective surgery. Right now, we don't feel we're in a position to increase it, so we're kind of just holding. But that's, you know, kind of the beauty of it, is we did it in a manner that lets us ramp up or ramp down depending on the changing conditions.
Right. Okay, so are we able to get an adequate supply of remdesivir?
So far, the supplies are continuing to come in. As I mentioned, they're still being managed entirely by the federal government. So the allocations are determined by the federal government, and they make the allocation to the county. And that allocation is based on the number of COVID positive patients that are hospitalized that we're reporting to the county, to the state, and to the federal government. So unfortunately, we're now having to pay for that remdesivir, though, at a cost of $3,200 per course of treatment. So a patient typically gets 5 doses or vials of remdesivir, and so that's a single course of treatment. It costs $3,200. So even though the allocations are all being managed by the federal government, we are paying the manufacturer $3,200 for every single patient without any additional funding from any of the payers. We don't get paid any more from Medicare or Medi-Cal or Blue Cross, but we now have a brand new $3,200 cost. And remdesivir absolutely has proven to be, we think, one of the more successful therapies. So it's almost part of our standard protocol to give remdesivir to COVID positive patients.
Okay, so back to the vaccine. So one of our community members is asking if Quia Delta is working with the federal or state government yet on an allocation that we will receive when the future vaccine is ready.
Yeah, not at this time. We're not involved, and usually, I don't know if that's kind of the phase 4, if there's any trials that are done at the hospital level. I don't believe that's the case, but I think it's probably too early in the process for us or even the county. I don't believe the county has been informed in any way of what vaccines, because they're still determining, you know, who's going to get the vaccine. You know, I think it's going to initially be population specific. There's going to be attributes or characteristics of the population, and then they'll have to determine, okay, how many of those people reside in Tulare County, and how will we disseminate that to the county, and then and where will the vaccines be administered? Is it going to be administered, you know, at the county level? I mean, obviously, we give flu vaccines to patients, our employees. Will it come that way, where we'll be vaccinating our own employees and our own patients? We haven't heard anything yet.
Yeah. So the employees, during the employee huddle, I'm getting a lot of questions about whether it's going to be a mandatory vaccine, you know, because the flu shot is kind of mandatory for our employees. If they don't take it, they just have to mask up for 4 or 5 months, 6 months out of the year. But one of the questions that we're going to be answering tomorrow is, if we're going to have to mask up anyways, do employees get to say no to the COVID vaccine?
Yeah, and I tell you, we've not had a single discussion around that yet. But you're right. Getting a flu vaccine for decades was voluntary, highly encouraged at Quia Delta, but voluntary. Until a few years ago, most hospitals across the country moved to a mandatory vaccination. And it's to protect our patients. It's not to, although we want our employees to be safe and healthy, it really it was the right thing to do to protect our patients from getting sick with the flu. So it became mandatory, and we have a very, very high vaccination rate. Roughly 95% of our employees do get vaccinated, but there is the option that if you're not going to be vaccinated, then you have to wear this mask. It's interesting. Nobody likes to wear a mask, so that was
Right.
kind of an incentive. I think I'll get vaccinated because I can't imagine having to wear a mask for 6 months.
Right.
Now that's all we do. And so
Right.
now people might be so accustomed, I'll just wear a mask. I know I can do that now. I don't know, I can't even begin to think about whether we'd make a COVID vaccine mandatory or not. Because I know there's going to be a tremendous amount of anxiety.
Yes.
There'll be a lot of people that don't want to take it.
Yeah. I think 50-50.
Yeah,
People
I
are
think you're
against
right.
it,
So,
afraid of it, anxious about
yeah,
it.
I don't know if I want to go there yet, but I'm thinking that it would not be mandatory. But you certainly, for the protection of our patients and the protection of our staff, then you'd continue to have to wear all the PPE, and but it'll depend.
Right.
Yeah.
Okay, Gary, it looks like our time is coming to an end.
Wow.
So we just want to say thank you so much for joining us for this weekly community huddle. And it's through your questions that we learn what we need to change or be more open about. And we hope you feel we are transparent and that we are open. You ask the questions and we get the answers, and we put it out there for everyone to see. But if you have questions about things, please do not hesitate to contact me, and I'll get with Gary and the team, and we'll make sure that you have the answers that you need. But thank you all so much for joining us.
Yeah, thank you. Thank you, Deb. It's good to be back.
Yeah.
Yeah.
And you'll be gone next week.
Yes.
So we'll try to
but
bring our duet in that entertained you all last week.
I haven't had an opportunity yet to watch their episode, but it sounds like I need to. And
You know what?
I don't think you've ever described mine as being lively, and so yeah, I can't
Well,
wait.
you know what? I think it should make you feel really good that when you're gone, you have people that can just jump
tell you,
in
I am-
and represent the district
Absolutely.
really
I
in an amazing way.
could not be more proud of them. And you picked two outstanding people to. They're so knowledgeable and obviously bring a different perspective, and so no, I think that was great. Maybe we should have more guest speakers.
Maybe
yeah.
I will. Maybe
Yeah.
I will. But you guys, thank you so much for taking the time to join us, and we're going to log off now, so have a fabulous day. Goodbye.